Today we're going to be discussing Chapter 24, Urinary and Male Genital Systems. The urinary system subsection, codes 50010 through 53899 of the CPT manual, is arranged anatomically by the subheadings of kidney, ureter, bladder, and urethra, with category codes arranged by the type of procedure. For example, incision, excision, introduction, and/or repair. Endoscopy codes are assigned according to approach. Either a previously established stoma is used as an entry point, which is created by placing a catheter through the skin into the kidney, or an incision. When coding endoscopy procedures, the coder must identify the entry method in order to assign the correct code. The incision codes 50010 through 50135 are assigned to report exploration, nephrostomy, drainage, nephrolithotomy, and pyelotomy services. Renal exploration is a procedure performed if the cause of the patient's condition is unknown. For example, a surgical exploration of an injured kidney when the patient clinically unstable and appears to be having renal blood loss. Access for the exploration procedure is from the side or the flank. When coding an exploration of the retroperitoneal space, be careful to determine the exact anatomical location or locations explored to report the correct services, because there are many organ systems located in the abdominal cavity. If something is found on the exploratory procedure and a corrective procedure ensues, do not bill for the exploratory procedure. Exploratory or diagnostic procedure would only be used if the surgical procedure was not done. It is important to know the difference in these terms and understand that the surgeon may start out performing a nephrotomy to explore the kidney and find the reason for the patient's urinary obstruction, and the procedure then becomes a nephrolithotomy when a calculus is found. One is the exploration, the other is an actual surgical procedure. ESW is used to be performed with a machine in which the patient was submerged in a fluid. Newer machines do not require submersion, rather that the patient is placed on an X-ray table and a water-filled cushion is placed under the patient's back. Generally, the patient is under general anesthesia while shock waves are targeting the stones, which are then pulverized with repeated shocks. The repeated shocks help break down large stones and makes them easier to pass. There are excision codes in the kidney subheading for biopsy, nephrectomy, which is removal of the kidney, and removal of a cyst. The biopsy codes 50200 and 50205 are based on the approach, either percutaneous, meaning through the skin, or by surgical exposure of the kidney. A nephrectomy is the removal of a kidney, either partial or radical. A radical nephrectomy includes the removal of the fascia and surrounding fatty tissue, regional lymph nodes, and the adrenal glands. Nephrectomies can also be performed by means of a laparoscope, codes 50543, 50545 through 50548. This will be based on whether the procedure was partial, radical, or donor, and also whether the procedure included a partial or total ureterectomy. Ablation is the cutting away or erosion of tissue. Code 50250 reports ablation of a kidney lesion by means of cryosurgery, meaning sub-freezing temperatures, and is usually performed with ultrasonic guidance. Allotransplantation is a transplant between two people who are not related. Autotransplantation is transfer of tissue from one part of the person's body to another part of the person's body, also known as autograft or autotransplant. A surgeon may perform a renal autotransplant to reposition the kidney, which may be necessary when the kidney has been severely damaged from trauma or disease. Repair category codes 50400 through 50540 include plastic surgery, pyeloplasty, suturing, nephrorrhaphy, and closure of fistula. Pyeloplasty is a surgical procedure for an obstruction of the uteropelvic junction, or UPJ, which connects the renal pelvis to the ureter. Usually, this is a congenital condition, but it may also be an acquired condition. If an obstruction occurs, the urine will not drain, which results in dilation of the collecting system and enlargement of the renal pelvis, or hydronephrosis. The goal of the pyeloplasty is to remove the obstruction and repair the renal pelvis. The laparoscopy codes 50541 through 50549 report ablation of renal cyst 50541 or lesions 50542. Open cryosurgical ablation of renal tumors is reported with code 50250, and the percutaneous ablation is reported with code 50593. Laparoscopic nephrectomies and pyeloplasties are also reported with codes from the laparoscopy category and are based on the extent of the procedure. Endoscopy codes 50551 through 50580 are frequently reported for kidney procedures because these types of procedures are less invasive than the open procedures and are often performed in an outpatient setting. Renal endoscopies may be performed by means of an established connection between the kidney and the exterior of the body. The ureter subheadings includes codes 50600 through 50980. Codes are divided according to the type of procedure: incision, excision, introduction, repair, laparoscopy, or endoscopy. The endoscopy codes in this subheading, codes 50951 through 50980, are used to report procedures that involve an established stoma. A bladder cuff is the tissue that connects the ureter to the bladder. Excision of the bladder cuff is only coded if it is the only procedure performed. If it is performed in conjunction with another procedure, it is bundled in and not reported separately. A total ureterectomy may be performed by means of an abdominal, vaginal, or perineal approach, or a combination of these three approaches. Code 50660 includes all three approaches or a combination of approaches. This means that if 2 or 3 approaches were utilized, you still only report 50660 one time. The bladder subheading 51020 through 51597 includes many usual services, for example, incision and excision, but it also contains urodynamic categories. When coding from this subheading, it will help you to know the anatomy of the bladder. Aspirations are done to remove urine from the bladder. If imaging guidance is used, this is separately reported. A cystostomy, codes 51020 through 51045, is often performed to fulgurate using electric current and inserting radioactive material or by cryosurgically destroying the lesion. In addition, the procedure is used for draining or the placement of catheter or stent. The injection procedures reported with codes 51600 through 51610 are for a urethral cystography, which is an X-ray of the lower urinary tract, also known as a cystourethropy. Insertion of bladder catheters may be non-indwelling, code 51701, or temporary indwelling, codes 51702 or 51703. The non-indwelling catheter is a type that is inserted into the urethra and manipulated into the bladder to drain residual urine. The temporary indwelling procedure can be a simple catheterization, such as with a Foley, or it can also be complicated catheterization due to an anatomical anomaly. Instillation is a procedure that is performed for bladder cancer. The carcinogenic agent that is instilled in the bladder is retained for a period of time with the patient lying down. The agent is then drained and the treatment is concluded. Urodynamics pertain to the motion of flow of urine. Urinary tract flow can be obstructed by renal calculi, or also known as kidney stones, narrowing of the ureter, cyst, and many other anomalies. The procedure in the urodynamic subheadings, codes 51725 through 51798, are to be conducted by or under the direct supervision of a physician, and all the instruments, equipment, supplies, and technical assistance necessary to conduct the procedure are bundled into the codes. If the physician performs only the professional component of the service, meaning he only assists in the interpretation of the procedure, then the modifier 26 is appended to the code. Repair procedures, codes 51800 through 51980, include procedures such as a cystoplasty, which is the bladder repair, cystourethroplasty, which is repair of the bladder and the urethra, and vesicouretropexy or urethropexy, which is the repair for urinary incontinence. Take special care in this category to read codes carefully. All of these procedures included are found in the description. Many third-party payers have a list of edits on codes that cannot be reported with other codes. Transurethral surgery codes 52204 through 52355 are for the urethra and or bladder, code 52204 through 52318, and for the ureter and or pelvis, codes 52320 through 52355. As in other areas, if a procedure starts as a diagnostic procedure and then turns into a surgical procedure, the diagnostic procedure is not billed. It would be bundled into the surgical procedure. Codes in this category are based on approach. Watch the wording, whether it is a resection or an incision. Many codes are divided based on whether the patient is male or female. The manipulation category codes 53600 through 53665 are a bit different from those you have encountered previously. Manipulation is performed on the urethra, for example, with dilation or catheterization. Dilation stretches or dilates a passage that has been narrowed. The dilation codes are based on initial or subsequent dilation of a male and or female patient. The male genital system subsection codes 54000 through 55899 of the CPT manual is divided into anatomic subheadings: penis, testes, epididymis, tunica vaginalis, scrotum, vas deferens, spermatic cord, seminal vesicles, and prostate. The category codes are divided according to the procedure. The next slide will show this list. The greatest number of category codes are under the subheading penis because there are many repair codes in this subheading. The other subheadings are primarily for incision and excision, with only a few repair codes for the remaining subheadings. Excision codes 54100 through 54164 include codes to report biopsy of the penis. To accomplish the biopsy, the physician removes a portion of a lesion by excision of a small section of the lesion, either by a scalpel or scissors. A punch biopsy is commonly used with skin lesions and is performed with an instrument that is a pencil-shaped that removes a round disc of tissue. The opening left by the punch may require simple closure or a suture depending on the size of the skin defect created by the biopsy. A more complex biopsy, 54105 of the penis, involves the deeper layers of the penis and may require laser closure, which is reported separately. The codes for biopsy are located under the anatomical subheading to which they refer. The incision category under the penis subheading differs from the codes in the integumentary system subsection in that the penis incision codes are used for deep incision, not simply for abscess of the skin. The incision category codes are 54000 through 54015. The destruction subcategory includes codes 54050 and 54065. Simple destruction is further divided by method of destruction. The code for extensive lesion destruction can be used regardless of the method employed. Peyronie disease is a curvature of the penis that results from plaque formation on the cavernous sheets of the penis, as illustrated in Figure 2412. The plaque develops on the lower and upper sides of the penis where the erectile tissue is located. Inflammation results and leads to the formation of scar tissue. Over time, this fibrous plaque bends the penis. In severe cases, the penis arches during erection, causing pain. Surgical correction of the curvature involves removal of the penile plaque, codes 54110 through 54112. Grafting of the defect may be necessary depending on the extent of the removal. Code 54110 reports the excision of penile plaque when no grafting is required, and 54111 or 54112 to report the excision when grafting is required. Circumcision descriptors now include a code for circumcision using a clamp or other device performed with a regional dorsal penile or ring block. In the 2006 CPT manual, the circumcision codes were divided by newborn and except newborn. Now the codes are divided by neonate, 20 days or less, and older than 28 days. The purpose of the clamp that is used for circumcision refrains the foreskin while it is being trimmed. Excision of the foreskin without clamping is typically sutured after the removal. The introduction category includes many procedures involving the corpora cavernosum, which is the spongy body of the penis. Such procedures include injection procedures for Peyronie disease and treatment for erectile dysfunction. Injection of steroids are also used to help decrease the pain, deformity, and fibrous tissue size. The repair category includes many plastic repairs or cosmetic repairs. Some repairs involve more than one stage. Many of the repair codes refer to repair of Chordee and Hypospadias. Chordee is a condition in which the penis has a ventral or downward curve and is a congenital deformity. Hypospadias is a congenital abnormality in which the urethromeatus, or the opening, is abnormally placed, usually along the ventral aspect or the underside of the shaft. Degrees of hypospadias are classified according to location, whether it be anterior, middle, and or posterior. Hypospadias may lead to Chordee. The farther from the glans penis the opening is, the greater the Chordee. An orchiectomy is the removal of a testes. CPT code 54520 through 54535 report orchiectomies based on if the procedure was a simple, radical, unilateral, bilateral, with or without testicular prosthesis insertion, and the approach used to gain access to the site. Watch for codes that specify unilateral or bilateral. If the procedure is done bilaterally, modifier 50 would be used unless the code is specified as bilateral. Undescended testes, also known as cryptorchidism, is a congenital condition in which the testes did not descend into the scrotal sac. The condition may be unilateral or bilateral. The testes may remain in the abdominal or inguinal or within the precostal areas, or may also move back and forth between the areas. Often, undescended testes is associated with a hernia, and if this was the case during the hernia repair procedure, the undescended testis is brought down into the scrotum and anchored with sutures, also known as an orchiopexy. An exploration may be necessary to locate the undescended testes, and the choice of codes would then be 54550 or 54560. This would be determined based on the approach used, inguinal, scrotal, or abdominal. The exploration codes report a unilateral procedure, so if a bilateral procedure was performed, modifier 50 would be appended. The epididymis is a narrow coiled tube located on the top of the testes that connects the efferent ducts at the back of each side of the testicle to the vas deferens. The epididymis is divided into the caput, which is the head, the corpus, body, and the cauda, which is the tail. The epididymis can become infected, inflamed, and or obstructed. Only 4 categories are in the epididymis subheading: incision, excision, exploration, and repair. Code 54700 is for an abscess or hematoma of the testes, scrotal space, or epididymis. Like the epididymis subheading, the tunica vaginalis contains only three categories: incision, excision, and repair. The tunica vaginalis is a serous sheath of the testes which can be the site of a hydrocele or fluid collection. The physician may aspirate the fluid or inject a substance such as a sclerosing agent, code 55000, to help prevent further accumulation of fluid. The scrotum is a sac that contains the testes. If an incision is performed on a lesion of the skin of the scrotum, refer to the integumentary system. However, if the abscess is in the scrotal wall and requires drainage, report procedure with 55100, which is drainage of scrotal wall abscess. If the abscess is of the epididymis, testes, and/or scrotal space, report the service with code 54700 because the code reports procedures to any of these three areas. The vas deferens is the tube that carries sperm from the testes to the ejaculatory duct and the urethra. A vasotomy, code 55200, is cutting into the vas deferens. Usually the procedure is performed to obtain a semen sample or to determine if there is obstruction. Code 55200 includes cannulization of the vas deferens. The code describes a unilateral or bilateral procedure, so there is no need to report modifier 50 with this code. A vasectomy, code 55250, is a procedure in which a section of the vas deferens is removed for purposes of sterilization. A vasotomy, 55300, may also be performed for a vasogram, seminal vesiculogram, or epididymogram, in which a colored dye is traced through the vas deferens to visualize any obstruction. The spermatic code is a collection of structures that suspend the testes in the scrotum. The procedures in this subheading are either performed excisionally or laparoscopically. The seminal vesicles are a pair of glands located posterior or behind to the bladder. The glands provide the majority of the fluid that becomes semen and empties into the ejaculatory ducts and the urethra. Seminal vesicle codes are located in codes 55600 through 55680 range. A vesiculotomy is a surgical cutting into the seminal vesicle. The approach can be by an incision into the lower abdomen or the perineum between the anus and the scrotum. Frequently, the procedure is performed to relieve pressure due to inflammation. There are two codes to report a vesiculotomy based on the extent of the dissection required to accomplish the procedure. If the procedure required simple dissection, report code 55600, and if complicated dissection was required, report code 55605. The codes are unilateral, so if bilateral procedure will require modifier 50. The most common conditions involving the prostate are inflammation, prostatitis, benign enlargement, BPH, or benign prostatic hypertrophy, and cancer. Prostate cancer is the most common type of cancer in men. Symptoms of BPH include urinary frequency, urgency, nocturia, decreasing in the force of urine, and feeling bladder not fully empty. Symptoms of BPH are caused by excess prostate tissue pressing against the urethra and bladder. Transurethral microwave heat treatment, also known as TUMT, code 53850, is the use of microwaves that are sent through a catheter and introduced into the urethra to coagulate excess prostate tissue and allow the urethra to be less constricted. Transurethral needle ablation, or TUNA, code 53852, is a procedure that utilizes radio frequency to create heat that is applied to the prostate to destroy excess prostate tissue. For some patients, these less radical treatments are not effective or advisable. For example, for patients with renal insufficiency, recurrent gross hematuria, or bladder stones because of BPH, a surgical procedure is the recommended treatment option. Surgical therapies include transurethral prostate incision, electrovaporization, and laser ablation and coagulation. Transurethral resection of the prostate, also known as TURP, codes 52601 or 52630, is the gold standard of surgical procedures for removal of tumor or prostatic tissue. A special type of cystoscope is inserted through the urethra. The scope has lights, valves for controlling irrigation fluids, and an electrical loop to remove tissue and or obstruction and cauterize blood vessels. The transurethral incision of the prostate, also known as TUIP, code 52450, is used when the prostate is only slightly enlarged. 2 incisions are made in the prostate to relieve the pressure on the urethra without removing any tissue. When a laser is used to accomplish the prostatectomy, the choice of codes is first based on whether the procedure was a coagulation, code 52647, or vaporization, code 52648. Code 52648 includes with or without transurethral resection of the prostate. Brachytherapy is typically performed in conjunction with a urologist and a radiation oncologist. The difference between the high dose and low dose methods: a high dose is temporary and performed by placement of small catheters into the prostate, and radiation treatment is delivered internally. Low dose is when permanent seeds are placed through a needle into the area between the scrotum and the anus.